analysis, of course, you can get details of that story and the tug of war on our socials at TV47KE on X, at TV47 News on Facebook, and you can catch me at Hibak Said. Moving on, the Kenya Union of Clinical Officers has threatened to hold countrywide demonstrations early next week if the Ministry of Health fails to pronounce the fate of 8,500 UHC workers hired during the COVID-19 period. And as Elizabeth Atieno now reports, the union has decried discrimination in positions recently advertised by the Public Service Commission, saying some cadres have been left out, especially on the policy-making department at the Ministry of Health.
Monday, the 4th of March 2024, the Ministry of Health is expected to receive over 8,500 UHC staff hired at the height of the COVID-19 pandemic, knocking on their doorstep. The UHC staff, led by some unionists, including the Kenya Union of Clinical Officers and the Union of Public Health Officers, have vowed to take their demonstrations to the Afya House building in a bid to know their fate 4 years later after they were promised employment on permanent and pensionable terms.
Their contracts, that 1 year is coming to an end in May. Yet, there is no clear information as to whether these people are going to be absorbed or not.
And there is a lot of uncertainties, and this has actually brought down their morale, and this affront line healthcare workers. The issues need to be addressed as soon as possible.
And that's not all. On the 27th of February 2024, the Public Service Commission re-advertised vacant positions at the Ministry of Health. This despite a court order issued in April 2023, halting the process, terming it discriminatory. A section of health unionists maintain that the positions of directors and heads of divisions within the ministry have only favored one cadre against 20 other cadres in the health sector.
We are going to cite them for contempt because a court of law has already determined that you cannot proceed in such a manner, and with impunity they have gone ahead to advertise ignoring that court order.
Directorate position kuanzia kwa DG katika Ministry of Health should be open for competitive. It should not be designated. Isiweko kwa ajili ya mtu mmoja kwa sababu wote wana qualification.
Recently there was career progression which was carried out in Naivasha, and it was only crafted for just managerial medics at Afya House. Those who have diploma and also high national diploma were left out.
The unionists have also taken issue with the delayed posting of interns in fields like those of clinicians, nutritionists, medical lab officers, and public health officers, further issuing a 7-day notice to the Ministry of Health to post them in their respective health facilities, or they will strike until the day their cries will be heard. Elizabeth Atieno, TV47, Nairobi.